Thank you, Dr. Smith, for the kind introduction. Today, I will highlight three main areas our two groups are collaborating on. Firstly, the dissemination of clinical materials. A wide range of clinical resources produced by the Mental Health Advisory Committee are available on the European CF Society Mental Health Working Group website. Facilitated by Dr. Anna Georgiopoulos as the liaison US representative, these materials, together with other resources such as the mental health screeners, have been shared with medical professionals and parent associations across Europe, including Bulgaria, Croatia, Slovenia, Estonia, Russia, Poland, Lithuania, Macedonia, Romania, Slovakia, the Czech Republic, and the Ukraine. Many of us from the Mental Health Working Group have either travelled or hosted groups from these countries. In some places, these screening and resources materials are the only guides available. These teams have responded with great relief and emotion, expressing how much our efforts are helping them acknowledge and screen for psychosocial difficulties, as well as providing ways to address the problems. As the Mental Health Working Group culturally adapts and translates these resources, we share them in turn with the CF Foundation to facilitate access for members of the CF community in the US who need or prefer to learn about mental health in a language other than English. Secondly, our groups have facilitated an exceptionally high level of peer support and clinical consultations between CF mental health professionals from Europe and the US. This includes formal discussion forums and sharing information on effective treatment approaches. Thirdly, we continue to collaborate on research in order to gather empirical evidence to inform clinical practice. One example is our joint publication on the experiences and preferences of people with CF and family caregivers on depression and anxiety screening at CF centres across Europe and the US. Results from this study show that despite differences observed between US and Europe, there is an overwhelming endorsement of integrating mental health into CF health. Indeed, the results suggest that wherever you are in the world, the act of screening may itself be considered an intervention. It allows for the acknowledgement and identification of mental health difficulties and provides an opportunity to focus on effective ways to cope in order to live well with CF. I've highlighted the wonderful synergy we have created by the close collaboration between Europe and the US. Despite different languages and cultures, we all share the language of mental health and its importance in enabling collaborative care while supporting those countries and communities with more limited resources.